everyone, welcome to my channel. Today I am going to deal with the topic emergency equipments and instruments. As we all know that nursing is a broad subject, broad profession, and there are many specializations like OBG, pediatric, medical nursing, and then surgical nursing. So there are many equipments and instruments used based on the specification. So in the previous videos I have shared you the instruments related to the general checkups, and then instruments related to the yesterday I have share the video related to the instruments used in OBG. So today we are going to deal with the instruments or emergency equipments which are been very useful at the time of emergency. So it is been divided into many sections or modules. So please do watch the channel so that you will get the idea and you will be very clearly understand the concept or the difference between the which items are being or the equipments or the instruments are used in which specification, what is the use, everything. So please do watch my videos. Okay, so first is the emergency equipment for instruments. In this, the first name of the equipment is a ventilator or the mechanical ventilator. As we all know that it is also known as artificial ventilation or artificial respiratory machine. So which provides the ventilation or the respiratory breathes to the patient. So it completely takes over breathing for a patient who is unable to breathe adequately of their own. It means that the patients won't have the lungs of the patient won't have the ability to breathe by themselves. So the patient will be on the ventilator or for a ventilation machine. So next is the automated external defibrillator, also known as defibrillator. So this is the one type of defibrillator. So a portable device used to analyze heart rhythm and deliver an electric shock to restore the normal rhythm. Pulse oximetry, a non-invasive procedure to measure oxygen saturation. It is a machine non-invasive, nothing but it does not require any invasion or into the body. It is been applied on the finger, tip of the finger. What it does, it helps to measure the oxygen saturation. These are the emergency equipments which are used at the time of emergencies or crises. So next is crash cart trolley. As the name indicates, trolley nothing but the emergency trolley. You can say it as emergency trolley. It is a wheeled cabinet which consists of emergency medications and resuscitation equipments. Wheeled cabinet is nothing but it is a trolley which has the wheels so that we can drag it and push it when there is a emergency. We can take it there. So bubble CPAP, continuous positive airway pressure, and CPAP mask. It means that it is available in the form of mask. That is CPAP. What is the full form? Continuous positive airway pressure. It is used for newborns with breathing problems. When the newborns have the breathing problems like respiratory distress syndrome, in that cases this CPAP machine is being used. So bubble, why the bubble is when a water is being stored in the glass and the pipe is being put in that, because of this bubble it creates a positive pressure. For that pressure, to maintain that pressure, these bubbles have been formation takes place so that it helps in measuring the pressure of the tube. So it helps in creating the continuous positive airway pressure. So next is the cardiac monitor. As the name indicates, it's an device used to measure the cardiac activity. Okay, an electric device that continuously tracks heart activity including rate, rhythm and electric patterns, ECG, electrocardiogram to detect abnormalities like arrhythmias. That is, increased heartbeat is known as tachycardia and decreased heartbeat is bradycardia, as I have mentioned in the previous videos. That is basic terminologies in nursing. So this is a device or a monitor used to maintain to track the heart activity, which includes the rate, rhythm and electric patterns. So next instrument is the DVT, that is deep vein thrombosis pump. So what is the use of it? A device which prevents the blood clots in deep vein thrombosis in legs. That is, it's a device which is used to treat the deep vein thrombosis which is seen in the legs. Okay, legs region it is seen. Next is the portal suction machine. What is the use of it? To remove the fluids like mucus, phlegm and blood from a patient's airways or surgical site. Mucus is nothing but the thin structure of the layer is known as the mucus. Phlegm is nothing but the thick structure of the secretions. What we get is that is known as phlegm. The thin secretions we know it as mucus. That is the main difference we have to Remember, mucus is a thin secretions and phlegm is a thick secretions. Next is the ECG machine or electrocardiograph that is used to record the heart's electrical activity. Nebulizer. What is nebulizer? Which delivers medication directly into the lungs in the form of mist. Next is syringe pump. What is the syringe pump? It is used to administer small amounts of fluid or medications. Next is infusion pump. What is infusion pump? It is used to deliver fluids, medications, nutrients into patient's body in controlled precise amount. Next is anesthesia machine. What is the use of it? To continuous supply volatile anesthetic agents for medical gases. What is next is phototherapy. This is used to treat the neonatal jaundice in the newborns or in the newborns. What happens after the baby is born? There will be a presence of neonatal jaundice in them. So at that time, the device used to treat them is the phototherapy. Phototherapy sessions will be done to treat the neonatal jaundice. Next is incubator. Incubator is a closed care system. That you have to make the difference. There is two types of system: closed care system and the open care system. Incubator is the closed care system. What is it is to provide controlled, safe, warmth and environment to neonates, especially low birth weight babies and the premature babies. What happens in closed care system? The baby is being placed in the closed space so that the temperature of the in this device or the machine, the temperature is been set. Okay, so that the baby inside the machine is very warm and is very safe environment. Next is radiant warmer or open care system. As a name you can see here, radiant. Radiant is nothing but the use of infrared rays. Open care system. Here how the it is closed care, but here it is the open care. Here baby is kept in the open space. Provides warmth to neonates using infrared heat from an overhead heating source. What happens when the baby is kept in the open care system? The baby up of the baby, that is the head surface of the baby, there is a heating system source provided which supplies the heat to the baby. So this is about the radiant warmer or open care system.